A shot in the arm of the Oxford University AstraZeneca vaccine, a world first for the UK. But any fanfare for the rollout of the initial 500,000 doses of the vaccine was lost and replaced by a realisation that the spread of COVID in the UK is out of control.
I think this is a really critical moment. We are at the point of being overwhelmed by this disease. So I think it gives us a bit of hope, but I think we've got some tough weeks ahead.
The UK Prime Minister Boris Johnson flagged the need for tougher restrictions, with infection rates still climbing beyond the levels of the first wave and the number dead now at 75,000.
Well, I'm going to obviously ask you to wait, and we will be producing everything that we think is necessary to keep people from spreading the virus. If you think about it, we've already got a lot of the country in Tier 4, some of it in Tier 3. What we've been waiting for is to see the impact of the Tier 4 measures on the virus.
Within a few hours of Johnson speaking, the First Minister of Scotland was on her feet before her devolved Parliament, announcing a full lockdown, which will run for the whole of January.
We have decided to introduce from midnight tonight for the duration of January a legal requirement to stay at home except for essential purposes. This is similar to the lockdown of March last year.
Next came an announcement that Boris Johnson will make a televised address later on Monday. He'll announce new restrictions for England, and Parliament will be recalled on Wednesday to vote on what he proposes. And there's another worrying development. A UK government scientific advisor is reported as saying that he's concerned the vaccines won't be as effective against a South African variant of COVID. Furthermore, Matt Hancock, the UK Health Secretary, says he's concerned because the South African variant seems to be more infectious than the UK strain. As the UK braces itself for tougher restrictions, the warnings from all quarters in this crisis are more stark than at any stage since the pandemic began. Hospitals are at the brink of being overrun. Andrew Simmons, Al Jazeera, London.
Dr. Marcus PLESCIA is the Chief Medical Officer at the Association of State and Territorial Health Officials. He joins us now live via Skype from Charlotte, North Carolina in the United States. Good to have you with us, Doctor. There are reports that say that the US is floating the idea of splitting doses of the vaccine to use perhaps the Pfizer one, the one from AstraZeneca, to reach more people. Certain idea, I think, is actually being trialled right now in the UK. Is that a good idea or not?
It's difficult to say. I think anything that would allow us to increase the reach of the vaccine would be helpful. But you know, any kind of changes like that in how the vaccine is used or how the doses are allocated would have to first be approved by the Food and Drug Administration.
These vaccines are supposed to be given in 2 doses. There's also talk now of, particularly in the UK, of delaying the second dose for up to 3 months instead of the 21 days. Is that a good idea too? I mean, would you still have immunity to the virus if you have that 3-month gap between jabs?
Well, the problem with that is that we don't have a lot of evidence of how that would impact the effectiveness of the vaccine. The information we have is from the trials that the vaccine manufacturers did, and they did those trials with this very specific period between the first dose and the second dose. So the concern would be that if you delay the second dose substantially like that, it might mean that then the ultimate immunity isn't as effective as what we had seen in the trials. So it's, you know, I guess it ends up just being a balance or a trade-off between trying to create a situation where we'll have more of the vaccine so that more people at least have some protection. But I think we want to be cautious that we don't undermine the true effectiveness of the vaccine, which is very good and which is one of the things that's really working in our favor.
You've got this new variant causing problems in the UK. It's a fast-spreading variant. Scotland has gone into lockdown. The chances are that England will follow suit in the next few hours when the Prime Minister speaks. There's also a new strain in Africa that's causing some concern. If the virus mutates, could it avoid the effect, the impact of vaccines altogether? Could it make the vaccines useless?
Right now, we don't think there's a great danger of viral mutations resulting in the vaccine being ineffective or even less effective. The vaccine is designed to recognize a fairly large piece of the virus called the spike protein, and that you'd have to have pretty substantial mutations for that to change so much that the vaccine wouldn't be effective anymore. So, we continue to monitor this very closely. But right now, there's really a lot of confidence, at least in what we're seeing so far, that the vaccine should work just fine with these variants as well.
OK, what about problems with the rollout of vaccines, in that people are getting the vaccine, but not nearly enough to give the community any kind of protection, in that the vaccine is still going to be out there? How many people do we need before we've beaten the virus?
Well, the exact number to reach what we refer to as herd immunity, where we really have things completely under control, that's still the subject of some speculation, but it's probably somewhere between 60 and 80%. But keep in mind that as we have more and more of the population vaccinated, that's that many less people who can spread the vaccine from each other. So I think that as we begin to administer the vaccine and have more people who've had it, and particularly vaccinating people who are at higher risk and more likely to pass the infection, like healthcare workers, we will begin to see some benefits from that. I think, even when we start to get up around 20% vaccination rates.
It's been really good to talk to you, sir. Many thanks indeed for being with us. Dr. Marcus Plescia there in Charlotte, North Carolina.